We are the internal medicine residents and we've been working in conjunction with the blood bank department. The name of our QI project is the Transfusion Reaction Response Optimization Project, achieving interventions within 60 minutes for enhanced patient safety.
The goal of our project is to reduce the turnaround time for reporting and intervening in transfusion reactions to less than 60 minutes. We have observed that our average turnaround time for the 2024 year was approximately 3 hours. We are campaigning with residents and nurses to bring it to less than 60 minutes. Post our intervention, we have observed that the transfusion reaction time were decreased to less than 1 hour for 3 of the transfusions.
Blood transfusion are a common procedure in a hospital and can be life-saving for our patients. However, with every transfusion comes a potential for an acute transfusion reaction, which can range from minor reactions to clinically life-threatening conditions. Early recognition of these reactions are very important to enhance patient safety.
My project is increasing intimate partner violence screening rates for women in our Women's Health Center. We are increasing the rates by screening a small 4-questionnaire screen to all patients for their annual visits, as well as each trimester in the pregnancies. Our results that we have seen are we are nearly about 70% in screening. Our goal is to have a 100% rate. The importance of this actually branched off from our project last year of increasing depression screening rates. This year we took it up a notch and now we are screening for intimate partner violence. The importance of this is because depression, as some of you may or may not know, is one of the leading causes of maternal mortality. This is very important in our patient safety.
Good afternoon. This is Dr. Aberdesky and Dr. Rigger from the psychiatry department.
And we're here to talk about our project, which is checking a report called Psyches and documenting that into patient's chart every single time. This report allows us to see where this patient has been receiving care at other hospitals and with outside providers, as well as medications that they've taken in the past and medical conditions that they have. Currently, our results are showing that we're able to check this and that we are checking this 100% of the time, and we were able to achieve that by putting a hard stop into our charting process. So we actually have to do that and have to document it before we're even able to sign off on our charts.
And by doing this, we're ensuring that the patients get the best possible collaborative care between the various interdisciplinary treatment team members, between, as Dr. Rigger said, inpatient, outpatient treatment, continuity of care, and overall the best possible treatment by reviewing prior, whether it's medication or various methods of treatment patients have received to further choose the best possible course.
The name of my project is Fall Risk Assessment, Analyze, and Prevention of Patients over the age of 65. In this project, we are using the Steady Eye tool, which is an assessment of fall risk in the Athena system, to ask patients that are over this age group to let us know, have they fallen, and for us to assess their risk. The purpose of the project is for us to be able to help to improve the morbidity and mortality rate in patients that have fallen. The data shows that after a patient over 65 has fallen, there's a decrease in their mobility and it increases their mortality rate. The results that we have seen, based on the data that we have been calculating since July, we noticed that when the screening is being done, patients are getting the proper recommendation to physical therapy as recommended by the CDC. We noticed that in the beginning we had a rate of 20% of screening, but as of right now, as of February, we have a rate of 67%. Our goal is to be at 75% and to maintain it consistently. This project is related to patient safety because, as we know, there's a high admission rate based on fall due to mechanical fall, and various factors play in. So our goal in this project is to bring awareness to this topic and long-term to decrease the fall risk among our patients over 65 and to help them live a much more fruitful and improve their quality of life.
Colorectal cancer is a worldwide leading cause of death. Screening colonoscopies are a great tool to decrease incidence of colorectal cancer. One of the measures that we take a look at is the adenoma detection rate, where a higher adenoma detection rate is linked to a lower risk of colorectal cancer. This month alone, we've had patients between the ages of 60 to 70 that had come in with a family history of colorectal cancer in their families, but without any prior screening colonoscopy. So these patients presented with high risk for obstruction, perforation, and bleeding, which lead to increased healthcare costs due to prolonged hospital stays, as well as the possibility of requiring chemotherapy for advanced disease. We performed a retrospective study between the period of August 2023 to August 2024, wherein our hospital performed 322 screening colonoscopies, which showed an adenoma detection rate of 27%. These results show that we are within a good limit, however lower compared to our neighboring academic institutions. Our goal from this study is to promote increased screening colonoscopies, as well as promoting patient education regarding the importance of colonoscopy, the importance of good bowel prep prior to the procedure, and overall taking into account patient demographics when we perform these screening tests.
The name of our project is called Nursing Home Accountability Improves Patient Outcome and Safety. So in a dermatology outpatient clinic, we found out that a lot of patients aren't getting better, especially in the nursing home patients. And even though we spend a lot of time with these patients, we talk to them about their treatment plans, and also we detail them clearly on their nursing home scenarios. But when they come back, they're not getting better, and a lot of times they're getting worse. So after speaking to these patients, we found out that the nursing home staff aren't actually following the instructions on the forms consistently and closely. A lot of times they are missing their prescription medication and creams, and also they're not getting their biologic medications on time to be effective. So this actually puts our patients' well-being and their outcomes at risk.
So our dermatology residency program created a project. Our quality improvement project is targeting this nursing home vulnerable population, and we are now improving outcomes by calling the nursing home staff directly. We're speaking to the nurses directly, the medical assistants in these facilities directly, and saying, hi, this is exactly how you use this medication. This is the time course of treatment. Please make sure this patient has transportation to follow up back to us in X amount of time. And we've noticed as a program that our more vulnerable, physically less independent patient populations are improving in their cutaneous manifestations. So as a whole, we would love to see this across St. John's. We have a lot of nursing home patients in the area, a ton of nursing home facilities in the area. So we would love to be able to publish this and make this a staple for all providers across specialties.